This year's COVID-19 lockdown were devastating. Border society more generally, the Southwest and Western Sydney community specifically, was left reeling.
Death, illness, economic distress, and social isolation were widespread as the 4-month-long lockdown swept through Sydney, upending lives and livelihoods. At a time of crisis, our community needed institutions and organisations to stand strong and deliver steadfast support in a sincere, authentic and effective way. And that is what Muslim Women Australia did.
As part of its COVID-19 response, MWA worked hard to provide hope over fear, a sense of calm and dignity in the delivery of services while advocating fiercely for our community in Southwest Sydney.
Southwest Sydney families were especially devastated by this year's lockdowns, with a higher level of casualised workforce, sole traders and unemployment, intersecting with distinct family and caring responsibilities, particularly within diversified household groupings. We saw a significant increase in referrals for financial and material relief, including rent assistance, as well as support for non-permanent citizens and temporary visa holders.
This showed us the severe financial impact this lockdown had, as did the feedback and communication people provided to us about feeling ostracised by a policy response that treated Western Sydney population very differently to other communities.
The mental and emotional effects of these pressures have been enormous. We saw this in the form of significantly increased demand for mental health services in support for women, including young people and particularly those in their senior years of high school. MWA established open and varied channels of communication with young people, listening to them and equipping them with the skills and knowledge to be active in their own circle of influence, as well as more broadly within the community, supporting community growth and strengthening community ties in an authentic way.
We help women more generally support their families and those around them through digital literacy, COVID update, individualised case management and helping meet the basic needs of life.
MWA also worked hard to prioritise our domestic and family violence homelessness intake. The increase in domestic and family violence was well documented during lockdowns, and we were there to support those affected from both a safety and a health perspective. Our transitional housing was at full capacity, and we also worked towards voluntary vaccine rollout for clients in shared settings.
We supported clients, including COVID-positive patients, through ongoing and consistent communication, direct service delivery and community outreach.
And finally, we intensified our advocacy both within this sector and more generally within the community, sharing our service learnings based on our experience and communicating with those in positions of power the importance of understanding our lived experience of our community.
While this period was far from easy, we have made it through as a community, at least for now. As we reflect on a challenging year, we know that by maintaining hope, advocating for our community, and bringing our patience and experience together, we can make a significant difference to helping our community heal even through the most difficult times.